Madam Chair, members, good afternoon. Ed Howard, Senior Counsel of the Children's Advocacy Institute, rising in passionate opposition to this language. This language regrettably elevates avoiding government embarrassment over preventing our children from being beaten nearly to death. The idea that the refusal of this bill to allow the public to see documents that are the real documents, the documents that genuinely show whether or not current procedures or best practices were followed is because the child is still alive, is respectfully not the justification for not providing original documents. Why? Consult the language of the bill itself. The language of the bill itself already requires all identifying information to be redacted. The bill also requires the child's counsel, whether directly or indirectly the child's counsel, to be notified to prevent disclosure. The bill also requires that law enforcement be notified to prevent disclosure. And after the redaction, after the notification of the child's counsel, after the notification to law enforcement, the idea that a summary prepared by an unknown and as yet potentially unqualified individual within the county who is going to be asked to essentially rat out their superiors or their colleagues in preparing a summary about a failure of CPS to prevent a child from being beaten nearly to death, no one will write such a summary. Madam Chair, had the law for children being beaten nearly to death been the prevailing law when it comes to children dying, the reforms that we've seen in your county, the desperately needed reforms that only came out not because of DSS oversight, not because of federal oversight, and not because of county oversight, that only came out as a result of independent audits spawned from investigative reporting, had the law proposed by this bill been the law for deaths, none of those reforms, none of those scandals would have come to light. We saw this language for the first time on Friday. We respectfully ask that this panel vote today to reject this language, and let's go back to the drawing board and do it right. Thank you.
Sunderland, you want a second?
May I for a moment?
Sure.
Appreciate that indulgence. Kathy Sunderling with the County Welfare Directors Association. Respectfully, Madam Chair and members, we must disagree with the assertion that the counties would somehow use the summary to whitewash the situation or hide the circumstances of what occurred. The list in the law of what must be provided is extensive. It is essentially the same list of information that must be provided in that summary that is in the SB 39 documents that must be released. The idea that a county would somehow not meet that requirement and instead provide the state, which is our oversight agency, with an account that doesn't provide the information that's requested, that doesn't provide the context that's needed to understand what happened, is, we don't understand how that could possibly happen.
Okay.
The individuals who are not involved in the abuse or neglect that leads to the near fatality, they're innocent. A sibling, a parent, a non-custodial parent, another adult who lives in the home, a relative, an aunt, as the gentleman indicated, if they have absolutely nothing to do with that abuse or neglect, why should their information be provided? That is a very reasonable piece to the proposed language that we think really is necessary to protect the privacy of people who are uninvolved in the situation that occurred, as tragic as it is. Mm-hmm. Finally, if anyone believes that there's additional information that needs to be provided, the judge can decide that through the WIC 827 process, as Mr. Cervenka noted. For those reasons, we again request your consideration and support.
Okay, thank you. Thank you, Mr. Howard, for, I didn't want us to get into a situation where we're going to do a back and forth. Clearly, this is an issue that has impassioned support and heated opposition. I'd like to give the department an opportunity to respond to some of the things the opposition said. And let me just put it out there now. We're going to hold the item open so these conversations can continue. I appreciate from the opposition's perspective that they saw the language for the first time through the release, I guess, of the May revise on Friday. And so clearly it's not cooked enough yet. And so we're going to spend a little more time giving opportunity for both sides to be heard. But would you like to respond at this point to some of the comments made? And then we'll open it up to LAL and finance. Or I did that already. I'll let you comment.
Very briefly, Madam Chair and members, I think the final point made by Ms. Senderling is rather compelling in our mind. Under current law, absent any near-fatality reporting statute, Section 827 exists in the law and allows a court to release the record to any party if there's a compelling public interest to do so. Fundamentally, this language, there's no proposed amendment to that section. That section continues to exist. If somebody feels that they're in need of actual records, they have an existing statutory avenue to get those records. In terms of the definition of near fatality in federal law, serious and or critical condition, our verbiage for that was overall condition of serious or critical. Same words, clearer meaning, federally approved as compliant with CAPTA. We think that provides the clarity we need. We believe that it's appropriate in the case of a near fatality to not disclose the records of the entire family history. We think the caseworker still working the case and involved in the case and the people overseeing have access to that information to do what they need to do. And because there's an allegation of abuse or neglect that led to a near fatality that requires investigation, isn't a compelling public interest reason to disclose the entire family's history of involvement in the child welfare system.
What if there's, let's say, a relatively large case file and some of the non-custodial parent or the family members had been involved in previous assertions of abuse? And so that you know, when you review accumulatively, suggests perhaps CPS intervention earlier could have made a difference. You follow me?
I follow you completely. Again, we're talking about a near fatal case where the child is still alive and the child welfare agency is actively involved in maintaining the health and safety of the kid going forward. Okay. So I think they have access to that information and should be making use of it, absolutely. But I don't believe even in redacted form that necessarily belongs in the public domain.
Senator Monning.
Thank you, Madam Chair. I appreciate the challenge of striking the correct balance here because clearly there are competing interests and the department appropriately is trying to protect confidentiality of medical records, et cetera. I do have a question, though, and maybe I'm just not reading in the right place, but identical meaning in federal law, you read the California language as serious or critical, but it says except in specified circumstances. What are the, I think Mr. Grimm took exception to expanding on the federal law with specified circumstances. Can you direct me to what those might be? If they're not in our agenda, we're going to leave this open, but that to me seems to be a focal point of some concern. What's wrong with just using
I believe that the reference was, and I don't want to speak for the testifier on this, that was the third-party homicide issue that I was referring to, where the people are not actually themselves involved in somehow in the situation that occurred. It's one thing to let your kid out at 3 o'clock in the morning unsupervised in a bad environment. It's quite another to be caught in a drive-by shooting after school on your way home. One could argue there was some parental neglect and involvement and failure to supervise in one case, and in the other, it could simply be you weren't even the intended target, it's accidental, and the child welfare system has nothing to learn from that. I believe that may be the exception that he was referring to, but again, I don't want to speak for the testifier.
Okay, thank you. And again, we will hold this open, so if there's some further additions that would educate us, we could receive those after the hearing. Did you have something, Mr. Lightmore?
Just to sort of respond, yes. We'll sort of look carefully at that language that defines it relative to the federal definition of near fatality, and if there's any inconsistency, we'll make sure that we highlight the rationale for it.
Great, thank you very much.
And I'm clear committee staff will be involved in the next day in terms of having conversations with both sides to see if we can come up with some compromise. Senator Stone.
Is there any precedent as to how other states have addressed these issues in their policies?
Good question.
We didn't do extensive research on what happens in other states. The fact is that every state that receives the CAPTA federal money has to be compliant with the CAPTA. We think our definitions are consistent with that. The fact that we said overall condition of serious and critical instead of serious or critical condition is an immaterial difference. And I'm sorry, we didn't survey other states to see their
We're leaving it open. You may look at what other states have done. There's nothing wrong with stealing a good idea from somebody else.
And I was going to ask also if the representative of the National Youth Law Program is aware of what other states have done. Either the come on to the mic, please. Any of the child advocacy organizations, if you are aware of what other states have done in response to Senator Stone's question.
I am aware, and many of them operate in different ways from California and from this situation. I mean, the Federal Children's Bureau has actually issued a directive that the full investigation, I'm quoting from their policy manual, may be disclosed. It's not required to be disclosed, but the best, as far as we're concerned, that's the best way to get public debate about what may or should or wasn't done in a situation. And the Federal Children's Bureau, interpreting the federal statute, says the full investigation may be disclosed with the appropriate identifying information redacted.
And are you aware of states who have written their own language to comply with that interpretation from the federal?
I don't know of other states, Madam Chairman, that have used the exact words full investigation, but I have looked at, I think it's New York, for example, where it's clear that all prior reports, not those restricted as this statute would, but all prior reports concerning the family, not just prior reports involving that particular child in the family, but all prior reports are disclosed because that gives you a fuller picture of what happened in this family leading up to the near fatality or fatality that might lead us to invoke changes in the way our systems operate.
Senator Monning.
Thank you. And if I could just ask a follow-up question on that. Clearly, you're coming at this, I mean, I think we're all coming from this, is what's in the best interest of the child and making sure there's not a repeat, especially in a near fatality. But you're quoting the federal law saying may release the full report. Sounds like you would favor mandating that, or do you see any circumstance where the exercise of some discretion in what's released would in fact be in the interest of that child?
I think in answer to your question, Senator Monning, I would favor release of the full investigation with the appropriate redactions to protect personally identifying information, because I think the alternative results in discretionary decision-making at the department level, and the department who may be suspect, not in all cases, but may be suspect, is going to be inclined to err on the side of omission rather than inclusion.
Thank you. That's helpful. Thank you.
Mitchell.
Director.
If I could just add, although I don't have a full list in front of me, and we'll certainly do what we can to provide one back to the committee. Last year, we did look at a number of states, and a number of states do summaries. But we're more than a year old on that reflection. And again, just to, not to be quarrelsome with Mr. Grimm or others, but a juvenile court judge under 827 of the code can release the entire file, and upon petition by any party that feels the county seems to be concealing information, minimizing culpability, it would be a very serious road that they would be on. Additionally, all fatalities and near fatalities are reported to the state. We issue an annual summary, which we put online. And where there are concerns about particular reports or cases, state staff assigned to the fatality report system follow up with individual cases, look at case files online, and in recent times we've been in counties doing specific reviews of detailed practice and occurrences. So I mean, I don't want to, I understand the concerns being expressed, but at the same time, I don't want to sort of say that the system is as shock absorber prone as it's being described. In fact, it is a very accountable, bounded system in California.
Thank you. It's clearly a very complex issue that we unfortunately don't have the time to fully flesh out and discuss. As I listen to the debate more and more, I also fully appreciate that there are studies and reports of general kind of a bias sometimes that impacts what families are involved in the child welfare system on the front end, and continuing to be, create an opportunity for full reports or to really kind of claw back into a family's entire child welfare engagement history could be problematic and unfair as well. So it's clearly, this is a complex issue that we're going to spend more time on. I would like to be involved in these conversations over the next day to see if we can come up with a solution that meets fundamentally the needs of children in the state of California. Again, we're going to hold this item open. Thank you very much. Let's move to issue 18, the director's favorite thing to talk about. Continuum of care reform.
Thank you, committee members.
Page 19.
And let me just start by thanking the legislature and the particular members here who have supported bringing this reform to life and have heard us present now several times. This is sort of the next stage in the implementation cycle. We're sort of excited to bring this forward. The change from governor's budget to the May revision falls in several areas, and Mr. Cervenka and I will sort of tag team going through this, but in the governor's budget, there were not any provisions at that point for changes to the rate structure. The May revision sort of funds that process both for resource family homes through a level of care system, provides rates for the short-term residential therapeutic programs and services only rates, as well as therapeutic foster care basic rates. It provides for increased activity and staff time for the child family teams on the child welfare side, increases the investment in the foster parent retention, recruitment, and support activities to sort of, as I've characterized it, sort of accomplish the surge needed for the urgent activities of recruitment for particularly relatives, but also non-relative FFAs, RFAs rather, to allow the transition of youth from higher levels of care and congregate care. It funds resource family approval processes, it funds an increased amount for training, and this budget it also includes an increased amount for the Department of Healthcare Services to support the mental health plans activities around certification of SDRTPs and FFAs for Medicaid reimbursement for mental health services. So the core concepts are now all sort of in place as we anticipated. I would note that most of the activities in the May revision budget, particularly rates and CFTs, are anticipated to be half-year activities or to sort of ramp up gradually in the earlier part of the year in the case of CFTs, whereas we're sort of anticipating the foster parent retention recruitment is sort of, the counties have already started with allocations that were made starting in December of this budget year, and we sort of expect that to be at full bore at this point. And by January, we expect resource family approval activities to be statewide at that point. So Let me sort of stop there on sort of what's changed from the governor's budget to the May revision. In terms of the advocate stakeholder involvement in the rate process, the involvement was in sort of looking at the concepts of tiered rates for level of care, as well as sort of concepts like the services-only components, so that services, whether provided by foster family agencies, community-based organizations, or conceivably counties themselves, could be made available, particularly to relative placements, so as to allow stable placement of kids there. The numbers that are now displayed were not previously shared with stakeholders, and these were made available with the revision. In terms of the levels of care, the new assessment tool, and sort of attaching that question to the fourth question, which is sort of what do we do before the tool is fully tested and deployed. The expectation is this: all children in placement currently will transition to a rate under the level of care rate. For children who are stably placed and there are no presenting issues, et cetera, the expectation is they would be placed at level 1, and then as needs, both in terms of the child or possibly in terms of the caregiver, are identified, that could lead to adjustment to levels 2, 3, or level 4 we see more as the step down coming down from higher level care. The tools that counties currently use to assess children's needs, the application of additional payments, specialized care increments, are in the short term what we are going to be sort of working with counties to both look at those assessment processes, looking at, we will provide sort of characteristics of child needs that we see as occurring at different levels, so there's some degree of guidance. And then through the quality improvement activity, case reviews, we'll have an opportunity to sort of work with counties to see if they seem to be, in the interim, applying them consistently. In the budget year, we're going to be, as the agenda mentioned, 2 assessment tools are going to be in essentially pilot stage in different counties in the state. And the expectation is that by spring, we'll normalize one of them. That isn't to say we will forbid the use of the other if a particular county is inclined to maintain that, but we also try to encourage and standardize towards one so that that becomes more of the instrument that can over time be utilized reliably or close to reliably to help assess child needs. But final sort of caveat on this is the child-family teaming process is essential to this. All of the assessment instruments, all of the tools, from our perspective, are simply intended to inform the child-family teaming process, not to be dispositive, not to say, oh, somebody came up with this assessment, therefore the following occurs. We want to be sure that the voice of the child and the voice of the family stay in that conversation, and it's not just driven by professionals who are observing the family or observing the child. Let me sort of stop there before pivoting to the next set of questions and just see what elaboration would be helpful for the committee in any particular part of this.
I guess for me, if I may, just focusing on the level of care.
Right.
I guess my curse is that I was here 25 years ago when we developed the level 1 through 13 structure. which was through the legislative process, as I recall. I'm sure there was some budget element. But again, it just goes back to the process, the time, the transparency, and even that was a rather arduous process. And so you'll see in the agenda, we continue to ask about stakeholder engagement and involvement, because for me, that's the gut check about whether it's realistic, workable, and doable. When I think about a 13-level kind of reimbursement process now being reshaped, I appreciate it's a new culture, a new way of looking at the population, but we do have a 20-plus year history that we're now transitioning into a new system, and your level of care has been released in the May Revised, which gives us a very brief window of doing our own fact-checking about, is this reasonable? Because we don't want to be in a position, as we're working very hard to expand the number of foster care homes to meet the need in this culture shift, to tie the hands or compromise counties in their ability to recruit and get foster parents able and ready to receive our current population, who are being reimbursed at a very different level. So help me by responding to some of the questions outlined in the agenda, the concerns raised by some of the advocates around whether or not it's realistic. And here I highlight it. So on page 22 of the agenda, where advocate concerns are summarized, they're concerned that the proposed CFT meetings aren't enough. They're unsure if the social worker cost is where it needs to be. There's some concern with the funding of the RFA piece, concern with the proposed rate structure. Again, commenting there's not sufficient time to review the new rates and assess their impact. There's a question as to whether counties are going to pick up the tab on anything not covered by the rates. There's a question about the rates don't account for current regional differences, but I don't know that the current rate system accounts for regional differences, so that may be a desire for a new rate system, but I know that the current system doesn't do that. So could you help me with that, please?
Of course, Senator. Let me first just clarify that, of course, the RCL 1 through 14 levels is only around group care. So that does not apply to the levels of care in the resource family system that are proposed in this. They're two different worlds.
This isn't the new level of care that we'll be transitioning that population into.
Right. What we're suggesting, well, what we're budgeting for in the May revision is that for the short-term residential treatment programs that will be, and these are what essentially we can analogize as being the replacement of that very high level 13, 14s, et cetera. That sets a rate that is higher than the current 13, 14 levels. That's the board and care supervision rate. Additionally, the services for meeting the therapeutic needs of children placed there are to be met through EPSDT reimbursed services, and that's why the requirement is that all SDRTPs have to be able to meet certification and contract with local mental health plans, et cetera. So that's not a reduction. Now, I've heard a question posed in the last couple of days, well, should there be a super rate or a higher rate? Let's not we can sort of define that forever in terms of parsing out. I think our belief is that meeting the needs of kids beyond the sort of care and supervision should be done through the provision of mental health services. But we certainly will be talking to people around that. The rest of the proposal.
So before you go on, I just want to make sure I'm clear so I don't make this mistake again. So the levels of care system and the rates you proposed apply to kids in the current system that are in group homes at the lower levels, or no?
The way the current rate structure works is, for oversimplification, levels 1 through 9 are considered sort of the lower level group homes. They, and the levels are denominated by, we hope, both the child's need as well as the staffing and the education levels, et cetera.
Kinds of services that are being provided and afforded
And
to
then
the child.
the sort of higher levels start to involve therapeutic services. So the proposal, well, what CCR does is it basically says the lower level group care is going to go away over a period of a few years.
Right.
Those youth will move into hopefully primarily relative care, maybe non-relative RFA care, in some instance, maybe into therapeutic foster care if there are elevated needs. Therapeutic foster care is anticipated to be somewhat time limited, but not with a hard time slot. Those youth who are still assessed as in need of therapeutic services with sort of 24/7 dimensions to it, that would be what we refer to in the rate structure as the STRTP higher level, again, short-term therapeutic placement. The levels 1 through 4 that are referred to in this refer to the rates to be paid to resource families, not congregate care institutions, but resource families where children are living.
I get that, but you're still saying that kids who are currently in level 1 through 9 congregate living situations would fit in the new structure in your LOC 1 through 4.